Guys, I want to talk to you guys a little bit about what I see pretty frequently with traumatic brain injuries. And so there's really neat research over the gut-brain connection over the vagus nerve. And so a lot of times when I see these patients, they've suffered, pretty significant head injuries, whether they were hit by a train, a tree, a severe motor vehicle accident, fell off of a roof, um, lots of other ways, even gunshot wounds to the head. And a lot of times what happens is these patients, so they get a brain injury, and there's research that shows that following a brain injury, the vagus nerve, which is a nerve that comes from the brainstem and it innervates your intestines as well as other organs, it can be weak. And one of the functions of the vagus nerve is it really stimulates the gastrointestinal tract. And you can see something called zonulin. Zonulin are going to be literally these little kind of barriers that keep the gut barrier stable. And so the vagus nerve is like right here, okay? And it innervates these zonulin, innervates the intestinal lining to keep it tight. If this brain or brain injury happens, just like this little mouse slide right here, you can see the intestinal lining looks similar to this right here, and see how this is kind of fragmented, it's kind of broken looking. We call this thing intestinal permeability. Whereas now what's happening is these little bitty zonulins are weak, and food can actually get down. Once it gets down here, this is called the gut-associated lymphoid tissue. They call it GALT. And then below that, you're going to see the vascular supply, and then that's what's going to go to the brain. So a lot of times with head injuries, especially in the hospital, patients can start getting infections. Maybe they have pneumonia, maybe they get a staph infection, maybe they start having seizure activity. And people are like, well, where do these infections come from? And they actually come because in our guts, our digestive system, we have all these bacteria, we have viruses, there's yeast, there's molds. They're normal typically to see sometimes in our gut, but once they cross a certain threshold, then you can get an infection. So if this brain injury happens and these barriers get leaky, or even open up, these pathogens can actually get in, and now they can actually start causing even autoimmunity issues. Or you can start seeing seizure activity or these infections that can go in the brain. So, we clinically like to do lots of vagus nerve stimulation. I'm a very, very big fan of a restricted diet, trying to get people on like, a paleo diet or ketogenic diet following head injuries, because I want to make sure that I put someone on a lower carb diet, just because if the vagus nerve's weak, the vagus nerve's job is to activate enzymes, and enzymes are going to help break your foods down. So if that nerve is weak, you don't get as many digestive enzymes. So if you eat a high carbohydrate diet, your body can't break that down. That turns into sugar, and sugar can actually feed yeast and mold and other type of pathogens in the body. So I typically like more of a high fat, high protein diet following head injuries, and then along with vagus nerve stimulation. But here you see right here, this is what the intestines looks like following a TBI. And then you see a normal healthy brain. And then you see how nice and smooth all these little barriers, this gut looks. So you're not going to see food sensitivity issues. You're not going to see typically as many infections and stuff with this as possible. So our goal is to actually do vagus nerve stimulation following in traumatic brain injuries. And just a little bit of some information from research. I'm a nerd. I like to read all the time. And this was a slide that Dr. Ryan Cedermark in our Atlanta office did. But I just want to show you guys the difference between a healthy brain, healthy intestine, a traumatic brain injury, and then the intestines look like this. So if someone does have something similar to this, what are some things that you can do? Vagus nerve stimulation is really, really neat. There's something called photobiomodulation, which is actually red light therapy over the gut to try to help improve that. The next thing I tell people to do is actually go out into the sun, get some sunlight to your stomach, literally like 15, 20, 30 minutes a day, depending on where you're at. But light actually is very, very beneficial. And, we typically wear clothes all day long, which is, typically natural to do, but it's pretty good to get out into the sun and get some sunlight, and especially to the abdominal region. So vagus nerve stimulation, photobiomodulation, low carb diets, high fat, high protein. Typically I like to follow the paleo diet, and then getting, sun on the actual stomach itself. And that's just a little bit of the tip of the day.